All right, we're here with our last section for Unit 4. It's all about disordered eating and eating disorders. So we're going to start off with a question, how do you view your body? What is your body image? All right? How do you perceive yourself when you look in the mirror? And we find when we do research and speak with people that this is pretty much thought of along a continuum, from one extreme to the other. So on one end, we might have people that just love, love, love their body, and then different degrees of how much you love your body, and then proceeding down to this end over here where you actually just loathe your body. So where do you fall on that spectrum? So let's talk a little bit about what an eating disorder is. It's a psychiatric condition involving extreme body dysfunction and long-term eating patterns that harm the body. So I have this video here for you that will let you look at some warning signs and symptoms of an eating disorder. So I would encourage you to watch that. All right, so if we look at this slide, we're going to look at different effects on an athlete's health disorders. So we want to know, first of all, that more athletes die from anorexia than any other psychiatric disorder. Medical complications of anorexia affect every body system, all right? So anywhere from your heart, poor circulation, low energy availability, disturbances in electrolytes, hormonal imbalances, organ failure, ultimately failure of your heart, your liver, and your kidneys. Dental problems, sleep disturbances, depression and anxiety, and suicide is the second leading cause of death. All right, so very, very serious topic. All right, so when we look at eating disorder effects on an athlete's sports performance, there's a whole host again of things that can happen, but you're going to see decreases in performance. You're going to see overall low nutrient intake resulting in depletion of things like muscle glycogen, increased use of protein for fuel, dehydration leading to fatigue, and again, things like the depression, anxiety, loss of concentration, and the ability to play with emotion. So again, very, very serious topic. This place called the McCollum Place Eating Disorder Centers, they have special programs for athletes. And so that's why I went to their website and using their information because their program and its focus on athletes. So are there different types of eating disorders? And the answer is yes. We're just going to talk about three: AN, anorexia nervosa, BN, bulimia nervosa, and then binge eating disorder. Right? So anorexia is the restriction of energy intake leading to significantly lower body weight in reference to your age, your sex, and physical health. It's an intense fear of becoming fat, all right, even though the person is underweight. Big body image disturbance, an undue influence of body weight on shape on how you view your own self-worth, all right, and denial that there is a problem and the seriousness of it. Bulimia, okay? So bulimia is defined as recurring binge episodes characterized by the following. So a binge is consuming a very large amount of food in a very short period of time. So here they're defining it as within a 2-hour period. And you have this sense of like an eating frenzy, you're out of control. And so you might have behaviors to compensate. So things like vomiting, laxative abuse, excessive exercise, diet pills. Binge eating and the compensatory behaviors that I mentioned, they're going to continue for at least once a week for about 3 months. And again, self-evaluation, how you see your self-worth is again influenced by your body shape and size. And then binge eating disorder are recurring episodes of eating large amounts of food, more than most people would eat, in a short period of time. You're eating rapidly. It's secret eating, marked with distress around the binges. You have this total lack of control over eating, or the sense of that, feeling like you can't stop. And the binge eating episodes happen at least once a week for 3 months, but you don't have the compensatory behaviors like you would with bulimia. All right, so treatment for eating disorders. All right, there's a video here that I want you to watch. I want you to know that it involves a team approach focused around the patient, most important, but a physician, nutrition, and psychiatric counselors, coach, and family and friends all play a role. Um, Typically, when someone knows someone who has an eating disorder that they care about, they want to rush in and solve the problem and use simple phrases and say, you know, if you would eat like this, everything would be fine. Or maybe be more reproachful, you know, saying, don't you know what you're doing to your body? And this is exactly the opposite of what you need to do. If you suspect a person you love has an eating disorder, you want to set aside a quiet time to meet with them. You want to rehearse what you say. You want to use I statements. And you want to express concern. So I feel upset or I feel concerned when I hear you vomiting. Right? So that's the way that you would approach someone that you love with an eating disorder. Let them know that you're there for them, encourage them to seek help. This video is a great video, hits all the points that I just mentioned. I'd really encourage you to watch it. Okay. Some other behaviors and concerns, these are REDS, orthorexia, and muscle dysmorphia. These technically are not eating disorders, although they can progress into an eating disorder. REDS, female athlete triad. So let's talk about that. So the female athlete triad is a serious medical syndrome that we typically see in female athletes that are involved in sports where low body weight or leanness is desirable. All right, so think of something like gymnastics, for example. And tri meaning three, so there's three cornerstones. So low energy availability, and we discussed what that was in the previous segment, okay? Low bone mass, all right, so we're losing calcium from our bones, and menstrual disturbances, so our menstrual cycle has irregularities to it. So these three aspects make up the cornerstones of the female athlete triad. So if you have low energy availability, that affects hormones, that help to regulate your menstrual cycle, and it also affects how your calcium storage in your bones, and bones start to lose calcium, they become weak, increased risk for stress fractures. Okay. However, this concept of low energy availability and its detrimental effects on your health needed to be expanded beyond females. All right, so the IOC, the International Olympic Committee, came out in 2014 with this concept of relative energy deficiency in sport called REDS. All right, and it emphasizes recognition of risks described in the female athlete triad to include males. Okay, obviously not the menstrual disturbances, but also people of various ethnicities, but males with, you know, this whole concept of relative or low energy availability. All right, so the syndrome of REDS refers to impaired physiological function, included but not limited to your metabolic rate, bone health, immunity, protein synthesis, heart health, cardiovascular health, all caused by not eating enough calories. Okay? So very important concept in sport now, and it ties into the low energy availability concept that we talked about with weight loss. All right, orthorexia nervosa. This is an obsession with healthy eating. This is where people become fixated on eating clean, all right? So it's why I really don't like that phrase, because people that have orthorexia are thinking about pure or clean foods and eating only them all of the time, all right? So it becomes an obsession. So, you know, they start to eat only a narrow range of foods. They eliminate foods or food groups, and a big sign of someone has orthorexia is that the self-isolation. They stop doing things with their friends and their teammates because they see hanging out with them or going out to eat with them as being problematic in being able to choose foods that are, again, clean. So it's not technically an eating disorder, but it is disordered eating, and it can progress to an eating disorder. And then the last thing we're going to talk about is muscle dysmorphia. So sometimes this is called bigorexia. Okay. And So here you see someone standing in the mirror, or looking in the mirror that is big, right? But they see themselves as small. So it's typically seen in males, starts in the late teen years, occurs in men who are already muscular. Depression's a characteristic, obsession with working out. If these people miss a workout, they become extremely distressed. They have, instead of a fear of becoming fat, they have a fear of shrinking. And they may neglect important life matters for exercise. Again, muscle dysmorphia. All right, so that ends this whole unit. It's the last of our material for the semester, and I hope you guys got a lot out of it. I know I sure enjoyed having you as students, and I wish you all well.